Okay, question 38. Digital and interdigital dermatitis, necrobacillosis, erosion of heels. It's all about the feet today. So let's talk about digital dermatitis first. I'm going to use this for both digital and interdigital. As you can see, it's between the digits, so it's not quite digital dermatitis, but we'll use this anyway. So digital dermatitis usually occurs in the plantar interdigital ridge. Oh, okay, so this is digital dermatitis, that's fine. It's usually caused by a number of bacteria, most commonly Fusobacterium species, but can be Campylobacter as well. And yeah, it usually occurs because of trauma. And what happens is moisture as well can also weaken the skin barrier, leading to bacteria infecting the area, like the Fusobacterium or Campylobacter we were talking about, leading to dermis, so skin inflammation, and then ulcerative dermatitis. So this is an ulcer forming. If it's chronic, you'll also get epidermal proliferation, meaning like skin will develop over this mass, resulting in what we call a hairy wart. So yeah, the clinical signs are quite obvious. You'll have a moist ulcer along the coronary band or the interdigital space, and it will bleed on palpation, but it won't cause lameness. And there are actually, it's very small because I've made the window smaller, but there are 5 stages. So stage 0 is obviously it's normal. Stage 1 is the lesions are 2 centimeters in diameter and they can be in the interdigital space. Now, stage 2, M2, is when it's painful or an acute red ulcer or even grey. And it can be greater than 2 centimeters. It's usually on the coronary band, at the skin, or, bless me, horn border around the dew claws, in wall cracks, and occasionally as a sole defect, so an issue here. And that's usually when you'll see lameness. M3, so stage 3 is when the lesion becomes very firm and scab-like, so it wouldn't look like this. And after topical therapy, the lesion will appear to be no longer painful. Stage 4 is when you get the hairy wart I mentioned. Now, I just want to say at stage 2, when you have the red ulcer, or even the grey ulcer being greater than 2 centimeters, it's still possible to heal because the bacteria can re-emerge. It's still possible to heal at that stage, but I'm sorry to say this, the bacteria can re-emerge in stages 3 and 4 lesions. So what was a stage 3 lesion is when it's more scab-like. Stage 4 is when you have the hairy wart. Sorry, I shouldn't have moved it. So how do you treat it? In a foot bath with formalin, so an antiseptic, scrub the area with soapy water. Obviously, you're going to use some local anesthetic as well before this, and you'll dry the area before applying some topical antibiotics like oxytetracycline. Also, they recommend adding in like a systemic antibiotic as well, let's say tetracycline. And then after that, you will add a dressing. But bacteria can thrive because, as we said, they're anaerobic bacteria, or maybe I didn't say that, I don't remember. But if something can thrive in moist environments, they generally don't need much oxygen, so bandaging it may not help. So it can thrive if you leave it open, if it's less severe. So let's say stage 1, stage 2. Now, if we're talking about interdigital dermatitis, it's the same thing, usually in the hind leg, but the etiology can be a bit different. Diclobacter nodosus is one example. Fusobacterium necrophorum, so that's one of the Fusobacterium species if you wanted a specific example. It's because of, yes, poor hygiene, it's muddy because of bacterial trauma, so it's very similar. Let's use this picture again. So the lesions are usually painful, but you will have a painful reaction. Again, they don't cause lameness, but what will happen is the interdigital skin erosion will start to smell. Now, if it's acute, it's usually not complicated, but it can become complicated when it's affected by other diseases like foot rot, which we'll talk about in a second. And that's when it becomes chronic, and then when it's chronic, that's when you get the epidermal thickening, kind of like the ulceration we were talking about. How do you treat it? Usually only treat for lameness and any topical antibiotics like oxytetracycline. Now, necrobacillosis, let's swap pictures just to make things more exciting. As you can see, it's a lot worse. Again, this is caused by Fusobacterium necrophorum. It's usually in the hind limb. And basically, the soft tissues in the interdigital space, maybe the adjacent coronary band, and even the pastern footlock higher up can be affected. The interdigital skin is discolored, as you can see. Like, this is a distinctly black foot, and this bit is white, which is a normal, and you have necrosis, maybe there are fragments with some smelly exudates there, and this actually leads to lameness, and increasing lameness occurs over time. And what will happen is they will no longer weight bear on this foot. They may even have systemic signs like fever. They won't eat. This, of course, if they don't eat, especially in a dairy cow, it affects their production, and the lesions can produce a secondary infection, making things worse. So as you can imagine, it's a bacteria. We're going to treat it with antibiotics. Doesn't matter how, intravenously, intramuscularly. It could be penicillin, trimethoprim, whatever you like. Next, we have heel erosion. This is quite gnarly. So this is progressive heel erosion, destruction. It's usually axially, and it's caused by Diplobacter nodosus, so the same one that causes interdigital dermatitis. Fusobacterium necrophorum. If you're not sure, always say Fusobacterium. And it usually, the pathogenesis is, initially the heel will be intact, but it will be eroded and pitted, so it'll have like maybe little dips like the moon, and the dips will basically join together and darken, forming a sort of V shape and a softer heel horn where the V is, and the heel may become totally worn away with age. So basically it gets worse over time. So the best thing to do is to trim the loose horn off, trim the heel off, and add some topical antibiotics like oxytetracycline, like I said previously. But just remember, when you're adding these antibiotics to the feet, it has to be dry, and of course regularly allow these cows to have a formalin foot bath. As I said before, formalin is an antiseptic.